Britain enters lockdown. Now people can only leave their homes for very limited reasons.
Without a huge national effort to halt the growth of this virus, there will come a moment when no health service in the world could possibly cope, because there won't be enough ventilators, enough intensive care beds, enough doctors and nurses.
But no national lockdown for the United States. President Trump says he wants to open up the country fairly soon. Meanwhile, the virus death toll in Spain rises above 2,000 and the health system does appear to be close to breaking. And we'll have the very latest from Australia, where the Premier of New South Wales now says the state is at a critical moment in its fight against the virus. And South Africa's president says he will impose a nationwide lockdown for 3 weeks from midnight on Thursday as part of its efforts to contain the outbreak. The army will be deployed to assist police during the lockdown. People will still be able to leave their homes to buy food, seek medical care and collect social grants. The country now has more than 400 cases after seeing a jump of 104 on Monday. Uganda's health minister has announced 8 new cases of the coronavirus, bringing the total number of confirmed infections there to 9. All are Ugandans who recently travelled to Dubai. The authorities are also trying to trace dozens of passengers who were on the same flight as the first case announced on Saturday night. Bangladesh is deploying troops to help contain the spread of the virus. Soldiers will monitor thousands who've been quarantined since returning to the country. As part of a 10-day partial lockdown, the government has also declared public holidays from Thursday to the 4th of April. The Iranian government is strongly advising people not to travel within the country as people are still celebrating the Persian New Year, or Nowruz. Iran is struggling to contain one of the biggest outbreaks outside China, with one person estimated to be dying from the disease every 10 minutes. More than 1,800 people so far are confirmed to have died. Rana Rahimpur has this report.
Ignoring the warnings, over the last 4 days, more than 8 million Iranians have been travelling to visit family members and to celebrate the Persian New Year. That's according to Iran's Red Crescent, who've been screening people for the virus at checkpoints across the country. Many thousands showed symptoms. The Iranian authorities are taking measures. Shrines have finally been closed and new hospitals are being built. But maybe too late. With more than 20,000 confirmed cases, the country's health service is struggling to cope. And it's the nurses and doctors who are paying the highest price.
Hey guys, are you all well? Unfortunately, I'm not well. I still have a fever. I'm taking multiple medications. God willing, they will work.
2 days after posting this video online, Dr. Mehdi Variji was dead. Dozens of medics have lost their lives battling Covid-19 in Iran.
Our staff are risking their lives here and we don't have the equipment. Just look at how unsafe my clothes are.
Just plastic bags tied around her feet. With Iran's medical staff completely stretched and millions of people refusing to stay in, officials are warning of a second wave coming in a few weeks, possibly killing far more people.